Hi, fellow nurses. My name is Karen Hogg, and I am a graduate student obtaining my MSN in nursing education. I have to insert a plug. I love the university I'm attending for my nursing education degree. It's SWAU, or Southwestern Adventist University, and it has a very robust program. So if you're looking to grow in your profession and obtain your master's in nursing ed, I highly recommend this program. Okay, plug over. Today, I will be teaching you how to determine the Apgar score of a newborn infant and how to complete the Newborn Gestational Age Assessment graph. By the end of this very brief video, you will also understand the purpose of the Apgar score and the importance of determining the gestational age of a newborn, as well as the most common potential complication you need to be aware of should your assessment reveal a premature infant. First, let's start by discussing the Apgar score. It is used to determine and assess fetal well-being after delivery, and it helps guide the direction that your interventions are going to take depending on the score. You may be asking yourself, do I really need to know this? And also, what in the world does a picture of the Grand Canyon have to do with this? Well, the obvious answer to the first question is yes, of course you need to know this. But there's another reason. Let me explain. When I was planning a family vacation to the Grand Canyon, I found out that of the 4.5 to 5 million visitors that go to the Grand Canyon every year, only 5% venture below the rim. I wanted our family to be part of the 5%, so we tackled a trail to ooh, ah point. Yes, that's what it's really called. During our visit, that took us below the rim. And now we can proudly boast that we are part of the 5% that have been below the rim or in the canyon. So, where am I going with this? May not believe this, but according to a cross-sectional study by Khatun et al. In 2024 involving 80 labor and delivery nurses, only about 25% demonstrated a good level of understanding of the Apgar score. That is a shocking result. I was blown away. I would have figured maybe something opposite of my Grand Canyon statistics, like 95% did and 5% didn't. So by the end of this video, you should be part of the elite 25% of nurses that understand the Apgar score. Let's get started. The Apgar scoring tool was developed by Dr. Virginia Apgar, an anesthesiologist, in 1952 for initial newborn evaluation. This scoring method assists in determining the immediate care needed for a newborn upon birth. And just for the record, Dr. Apgar did not create the mnemonic Apgar. That actually was created much later by someone else. The Apgar score is used to assess fetal well-being after delivery and determine the level of interventions that may be needed. For example, is this newborn healthy, handling extrauterine life well, or is this newborn struggling? Does this newborn need interventions or even resuscitation? The Apgar score will help you determine this. As you can see in this chart, the Apgar score evaluates infants on 5 critical criteria using the mnemonic Apgar. We have activity, pulse, grimace, appearance, and respiration. When Dr. Virginia Apgar first created this scoring tool, she simply referred to them as muscle tone, heart rate, reflex irritability, skin color, and respiration. There are 3 possible scores for each category, a 0, 1, or 2 points. If an infant scored 0 in all 5 categories, then the total score would be 0. That's the lowest possible score that you can give an infant. And if an infant were to score 2 points in each of the 5 categories, then the highest possible score a newborn could receive is 10 points. This evaluation is done within the first minute after birth, and again around 5 minutes after birth. If the newborn scores 7 or less, and for those requiring resuscitation, then additional evaluations are done at 5-minute intervals as a method for monitoring response until the newborn is approximately 20 minutes of age. To reiterate, only the score at the 1-minute and 5-minute mark are required, and any additional scores are for reevaluation if needed for a 5-minute score of 7 or less. Personally, I'm a visual learner, so let's break this down visually. Here along the left, we have the 5 categories in our Apgar score, and across the top, we have how many points can be given depending on what we determine within each category. Keep in mind that you don't need to overthink this. This is not a complicated process whatsoever. It's actually very simple. And most nurses simply do this in their mind. So let's start with the first category, appearance. Looking at the three options, either the baby is going to get 0 points because he's blue and cyanotic, or 1 point if we perhaps see a pink body with cyanotic extremities, and medical terminology freebie here, that's acrocyanosis, and then 2 points if the baby's complete body is pink. Looking at the second category regarding the pulse, this is very simple. If there's no pulse, it's 0 points. If the pulse is less than 100, that is 1 point. And if his pulse is greater than 100, that is 2 points. This can be done either with a pulse oximeter or simply with your stethoscope, or in some cases, you can simply apply leads and look at the EKG reading. For the third category, we are reviewing baby's grimace. Are we seeing no grimace whatsoever? Is baby floppy with no response? That would be 0 points. If we're seeing minimal response with stimulation, perhaps a little bit of withdrawal or facial grimace, that would receive 1 point. If you clearly see baby sneezing, crying, coughing, pulling away with a prompt response, then this would receive 2 points. For our fourth category, we are going to be assessing muscle tone or the baby's activity. If the baby is not moving at all and is flaccid, that would be 0 points. If the baby has flexed arms and legs, then that would be 1 point. And if there's active motion or flailing of those arms and legs, for example, that would be 2 points. Our final category may indeed be the easiest. It is respirations of baby. If there are no respirations, absent, not breathing at all, that's a 0. If there are some respirations, but it's weak or slow or irregular, that would be a 1. And of course, if you see that vigorous, strong cry, that would be a 2. When you add up each of these points, you should get a total that you can look at right here to see where it falls. A baby with a score between 7 and 10 is considered to be in excellent condition and adapting to extrauterine life very well. A baby with a score between 4 and 6 is moderately depressed and may require some intervention. An infant with a score between 0 and 3 is severely depressed, and this is a sign of an emergency. The nurse should immediately call a code. Remember, for any newborn who has a score of 7 or less after that 5-minute reassessment, then you would want to reassess every 5 minutes until we reach that excellent condition category between 7 and 10 for up to 20 minutes. Okay, let's test your understanding so far. This neonate was just born and even has the umbilical cord still attached, as you can see in the photograph. I want you to determine the baby's 1-minute Apgar score. How would you score this newborn with a heart rate of 136 by what you see here in this image? I'll give you a minute. So how did you do? Did you get a total score of 9? Let's break it down together. So I think this infant has acrocyanosis. His head and trunk look very pink, but like his hands do look blue and his feet do look a little bluish. So I would give him 1 point for being acrocyanotic. As far as his heart rate, we know it was 136, so it was greater than 100, so he would get 2 points for that. Regarding reflex irritability, he is actively withdrawing with his cry, so he would get 2 points for that. Muscle tone appears to have active motion as evidenced by his crying and withdrawing, so 2 points for that. And then because he looks like he's crying, he probably has a very good strong cry, which would be another 2 points. So his total score would be 9. As you can tell by this practice assessment, that if an infant is completely pink and crying, you could almost automatically assign a points total of 10. But if you have a flaccid, limp infant that is cyanotic and not crying or breathing, then you can quickly determine his total score would be 0. Let's take a look at one more example together this time. I won't make you test yourself again. With this infant, which I know is almost hard to watch sometimes or to see this, his color is cyanotic. So he would get 0 points, correct, for being cyanotic. His heart rate is 40, so that would be 1 point for less than 100, great. Reflex irritability, he has none. 0 points, good. Muscle tone or activity, he is limp. Very good. And respiratory rate is absent. If we tally up our points here, we have a total score of only 1 for this infant. According to Simon et al. 2026, although the Apgar score is the accepted assessment method endorsed by the American College of Obstetricians and Gynecologists and the American Academy of Pediatrics, Apgar scores may vary with gestational age, birth weight, maternal medications, drug use or anesthesia, and congenital anomalies. Several components of the score are also subjective and prone to inter-rater variability. Thus, the Apgar score is limited because it provides somewhat subjective information about an infant's physiology at a point in time. It's important to remember that resuscitation should always take precedence over calculating a clinical score. However, it is still the gold standard for assessing a newborn immediately after birth. Now, let's look at the gestational age assessment graph. Newborns are plotted on this graph based on their weight in grams along the y-axis, as you can see here, and their gestational age in weeks along the x-axis at the bottom. All newborns will fall into one of 3 categories, as you can see here. They will either be considered large for gestational age, which is 90th percentile or greater, and that covers this blue section. They will be appropriate for gestational age, which is between the 90th and the 10th percentile in this yellow section, or they would be considered small for gestational age, which is 10% or less in this pink section. For example, if we take a newborn who is born at 36 weeks gestational age and who weighs 2,000 grams, then we would plot him right here in this spot on our graph. Our newborn would be determined to be small for gestational age. These 3 categories help determine the interdisciplinary care necessary for the newborn, especially premature newborns who are at much higher risk of mortality. If a neonate is determined to be small for gestational age and/or is born prematurely, they are at a much higher risk for complications. A discussion regarding the pathophysiology of premature newborns and the complications that may develop is beyond the scope of this video. However, it's worthy to note that according to Best et al. 2022, respiratory complications are the most commonly observed complications in a premature newborn and require both monitoring and pharmacological interventions. Pulmonary surfactant is most often administered to prevent and treat a diagnosis of respiratory distress syndrome in a premature newborn. Welcome to the elite 25%. Because of your new knowledge and understanding of the Apgar score and the use of the gestational age assessment graph, you will be able to determine if baby is thriving in its new extrauterine environment or if baby requires medical interventions such as resuscitation. You will also be aware if baby is small for gestational age and at a higher risk for respiratory complications requiring pharmacological interventions. Well, nurses, you should now understand how to determine an Apgar score and how to complete the newborn gestational age assessment graph. You should also now understand the purpose of the Apgar score and the importance of determining the gestational age of a newborn, as well as the most common potential complication you need to be aware of should your assessment reveal a premature infant. And hopefully now you are in the 25% of nurses that do understand how to complete an Apgar score. Thank you so much for taking the time to watch this video, and I hope you now feel more confident as a nurse in the labor and delivery department.